Is high for many people, adults and children, when it comes to needles. New research reveals that virtual reality headsets may act as a distraction and help ease some of those nerves. Joining us to talk more about this new approach is Dr. Reena Mehta from Uptown Allergy and Asthma. Dr. Mehta, good morning to you. So how are they using, this was a study out of Hong Kong, and they used virtual reality headsets on people?
Exactly. Good morning. So this was a study recently published in JAMA Network, where they took 149 children and they basically broke them up into two groups. They were ages 4 to 12, and they had a control group and an intervention group. So the control group was a group where they did, standard blood draw. So they talked to the child about the procedure and, used comforting words. And the intervention group was children who actually got to wear a headset, which did virtual reality, where they got to play a game. And during the virtual reality game, the process of what was happening with the blood draw was explained to the child.
And this had the effect, according to the study, of lowering the procedure times?
Yeah, exactly. So they found several key points. So they found that the lowering of procedure time, so normally using your standard approach, it was about 6.5 minutes to get the blood. And using virtual reality headsets in kids, they were able to draw their blood within 4.5 minutes, so 2-minute time difference.
And we were laughing going into this about the different reactions. You see people in your own practice, somebody might seem like a big tough guy, but some people just don't like needles.
All the time. I mean, I give a lot of shots in my office. I order a lot of blood draws. And so something like this could be really helpful, because in the study, they found that those children who use virtual reality headsets had less pain, had less anxiety, and then some objective measures. They had less increase in heart rate, and their stress hormone, their cortisol levels were lower. So it really just shows that all around, if you have something to distract you, then you're not focused as much on the actual task that's happening. And so then you're not feeling less anxious, and then you're not feeling as much pain.
And this is not about pain, but people who are nervous about taking a flight, you see people on planes all the time kind of throwing the headsets on, getting in their own little space, if they will. So the same concept?
Same concept. There's a lot of avenues to use virtual reality. It really can be a great distraction. I was thinking about it for myself as a parent. Also, having your child go through a blood draw or a needle stick can be really traumatic as well. So, I mean, if it's provided to parents as well, it may actually help anxiety across the board for not just kids, but also adults, and also for multiple avenues of things that cause anxiety.
In terms of what's happening here from a medical standpoint, how are anxiety and pain linked? Is there some science here to this?
Exactly. Yeah. Most people think they're two different things, but no, if you're anxious, then you're automatically stimulating a stress hormone to go off in your body that goes to your brain and to your hypothalamus. And then you start actually experiencing more pain than you otherwise would. So you get the stimulus of a needle to your arm, but if you're anxious about it, that increases your stress hormone even more, makes you more sensitive, and you feel even more pain.
I'm almost out of time, but is this different between children and adults, or is it basically?
No, same concept. I just think with adults, they can ration it better, like, short-term blood draw for a long-term gain. I think for kids, they don't have the maturity to make that connection that, I have to do this so that I can get the blood draw, so that there's, some positive thing on the other end of it. And so I think the anxiety in kids it's harder, because they don't have the maturity to be able to ration what's happening.
Fascinating. All right, Dr. Reena Mehta, thanks as always.
Thank you so much for having me.